Effective diabetes management in primary care. Diabetes mellitus is a chronic metabolic disorder characterized by elevated levels of blood glucose called hyperglycemia, due to either insufficient production of insulin by the pancreas, resistance to insulin action, or both. Insulin is a hormone that regulates blood sugar levels and allows cells to use glucose for energy. Types of diabetes. 1. Type 1 diabetes. This results from the autoimmune destruction of insulin-producing beta cells in the pancreas, leading to an absolute deficiency of insulin production. Type 1 diabetes typically develops in childhood or adolescence, although it can occur at any age. 2. Type 2 diabetes. This is characterized by insulin resistance, where cells fail to respond effectively to insulin, and relative insulin deficiency. Type 2 diabetes is the most common form of diabetes and is often associated with lifestyle factors such as obesity, physical inactivity, and unhealthy dietary habits. 3. Gestational diabetes mellitus, GDM. This type of diabetes occurs during pregnancy when blood glucose levels rise higher than normal but are not high enough to be classified as diabetes. GDM increases the risk of complications for both the mother and the baby and may lead to the development of type 2 diabetes later in life. Prevalence of diabetes. Diabetes is a global health concern with increasing prevalence rates worldwide. According to the International Diabetes Federation (IDF), as of 2019, approximately 463 million adults, 20 to 79 years of age, were living with diabetes globally. This number is projected to rise to 700 million by 2045 if current trends continue. The majority of people with diabetes have type 2 diabetes. Prevalence of diabetes in India. India has a particularly high burden of diabetes, attributed to factors such as urbanization, sedentary lifestyles, and genetic predisposition. According to the IDF Diabetes Atlas 2019, India ranked second in the world in terms of the number of adults, 20 to 79 years, with diabetes, with an estimated 77 million cases. The prevalence of diabetes in India varies by region and population group, with higher rates observed in urban areas and among affluent populations. The prevalence of diabetes is also increasing among younger age groups in India, which is a cause for concern. Diagnosis of diabetes. 1. Fasting plasma glucose, FPG, test. The FPG test measures blood glucose levels after an overnight fast of at least 8 hours. A diagnosis of diabetes is made if the fasting glucose level is equal to or greater than 126 mg per deciliter or mg per dl on two separate occasions. 2. Oral glucose tolerance test OGTT. The OGTT involves measuring blood glucose levels before and 2 hours after consuming a glucose-rich beverage. A diagnosis of diabetes is made if the 2-hour glucose level is equal to or greater than 200 mg per dl. 3. HbA1c test glycated hemoglobin test. The A1C test provides an average of blood glucose levels over the past 2 to 3 months by measuring the percentage of hemoglobin that is glycated or attached to glucose. A diagnosis of diabetes is made if the A1C level is equal to or greater than 6.5%. 4. Random plasma glucose test. This test measures blood glucose levels at any time of the day, regardless of the last meal. A diagnosis of diabetes is considered if the random glucose level is equal to or greater than 200 mg per dl in the presence of classic symptoms of hyperglycemia, for example, polyuria, polydipsia, unexplained weight loss. Screening for diabetes. 1. General population screening. The American Diabetes Association (ADA) recommends screening for type 2 diabetes in asymptomatic adults with a body mass index (BMI) of 25 or greater and one or more additional risk factors, such as physical inactivity, family history of diabetes, high-risk ethnicity. Example: African American, Hispanic, Native American, Asian American, Pacific Islander. History of gestational diabetes or giving birth to a baby weighing over 9 pounds or 4.1 kilograms. Hypertension, blood pressure greater than or equal to 140/90 mmHg or receiving treatment for hypertension. High-density lipoprotein HDL cholesterol level less than 35 mg per dl, 0.90 mol per L, and or a triglyceride level greater than 250 mg per dl, or 2.82 mol per L. History of cardiovascular disease. 2. Gestational diabetes screening. Pregnant women are typically screened for gestational diabetes between 24 and 28 weeks of gestation using an OGTT. Women with risk factors for gestational diabetes may be screened earlier in pregnancy. 3. Postpartum screening. Women diagnosed with gestational diabetes should undergo postpartum screening for persistent diabetes or prediabetes at 6 to 12 weeks post-delivery. 4. Children and adolescents. Screening for type 2 diabetes should be considered in children and adolescents who are overweight or obese, BMI greater than or equal to 85th percentile for age and sex, and have additional risk factors. It's important to note that screening and diagnostic criteria may vary based on regional guidelines and individual patient characteristics. Healthcare providers should consider a comprehensive assessment of risk factors and clinical judgment.